Now I'd like to introduce our student speaker, Ajay Parikh. Ajay is a member of our first global health major class. He paired his global health studies with a degree in public policy. Ajay developed his passion for global health and poverty reduction after he studied abroad in Udaipur, India, and in Beijing, China, in the spring of his junior year. He was so energized by his experiences in India and Beijing that he followed up his semester abroad by returning to India that summer to complete a research internship. Now, in Bangalore, he conducted an independent research project on health-seeking behaviors, health communication, and health awareness in urban Indian slums. He interviewed over 100 residents and across dozens of different Bangalore slums, as well as caretakers, pharmacists, and physicians, to better understand how the poor navigate the Indian healthcare system. In the future, he hopes to earn an MD and an MPH, and he believes that his experiences in global health at Duke will have equipped him with the tools needed to be effective, competent, and globally minded physician. I think you're already close to there, except for the physician part. We're honored to have him speak to you now, representing his class.
Thank you, Dr. Bennett. And thank you all for this opportunity to speak at this wonderful Global Health Commencement ceremony. Today, as we look back on all of our amazing accomplishments as global health students over the past 4 years, I would like to share a story with you that is very personal to me and that I think will resonate with many of us in the room. Last summer, I was in Bangalore, India, conducting an individual research project on health-seeking behaviors and health awareness in urban Indian slums. And part of the project involved traveling into different slums, different neighborhoods, speaking with individual slum dwellers, and conducting a survey, just a basic questionnaire. And I remember being in one such slum on a very rainy day. It was really hot, rainy, and muggy, and me and my co-researcher were having a tough time getting through the slums without being completely drenched in sweat. It was pouring outside, and my co-researcher and I were in between interviews in this cramped, unfamiliar neighborhood, desperately looking for shelter as the rain pelted our heads and turned our questionnaires soggy. We hurried towards a small home with a protruding roof, just enough room for the two of us to stay dry under until the rain passed. The door to the tiny house was open, and there was an old woman just sitting on her bed, and she gestured for us to come inside so we wouldn't get wet. We asked if she'd be willing to take part, to help us with our health survey. She smiled gently and pulled the back of her sari over her gray hair, the wrinkles at the corners of her mouth smoothing out to reveal a set of crooked yellow teeth. Yes, yes, she said in Hindi, of course. She looked like she was in her mid-80s, but I was surprised to learn that she had actually just turned 60 years old. It was a stark reminder that there's something about living in poverty that physically wears people down, making them look much older than they really are. During the interview, the woman made a circle with her fingers and brought them close to her sternum. She said she had a hole in her chest, suggesting that she had a heart condition. She told us she had been taking medicines and visiting different government doctors for the past 20 years, since her husband had passed away and left her to take care of their 7 children by herself. She then reached under her bag and grabbed out a big bag of different sorts of tablets, syrups, patches, all sorts of things, 10 to 15 different kinds of things that she just laid out in front of us on the bed. She asked me to read the names of the medicines aloud to her. After all, she was illiterate and couldn't read any of the labels herself, and she had been taking these daily for the past 20 years. I wanted to ask her about her children, but she beat me to it. She explained that most of her children had left the slum, but she still lived alone with her youngest son, who had problems with his eyesight. Her family could not afford an operation to fix his condition. The circumstances took a toll on her son, who had turned to alcohol and now did nothing except drink during the day and come home very late at night. She then reached out with her right hand. "Touch it," she said. I gingerly ran my fingers over her palm. She looked up at me, shook her head, and said, "I can't feel anything." She told us that she had been experiencing joint pains for the past few years and that she struggles to fetch water by herself. As I tried to comprehend life without feelings in my hand, I looked up at the woman. She looked back at me, her eyes welled up, and she started to cry. It was such a controlled expression of emotion. She stifled her sobs and spoke as if she didn't even realize that tears were streaming down her face. The words gushed out of her without any prompting whatsoever, as if they had been bottled up forever and finally had the chance to escape. "No one comes to see me," she sighed. "I have a daughter-in-law that lives just a couple houses down, and I haven't seen her in over 3 months. The neighbors don't talk to me because my son is a drunk, but how can I abandon my youngest child?" She wiped away a tear with the corner of her sari and then said, "I don't want to be a burden on my kids anymore. I want to move into a nursing home, but it's expensive." She raised her right hand, the same feelingless hand I had just touched a few moments ago, her palm facing the heavens. How am I going to pay for it all? In that moment, I felt like I was suspended in her tears, paralyzed, unsure of what to say or do. I was completely overwhelmed with helplessness. My experience with the woman in Bangalore revealed to me much about the state of health in the developing world. Her story highlighted the increased prevalence of non-communicable diseases, like chronic heart disease and diabetes worldwide. It demonstrated how the cost of treatment can be exorbitantly high and is often a barrier to health care for the poor. It showed how a lack of education and illiteracy can keep people, especially women, from obtaining adequate care. Most importantly, her story demonstrated how health is not just determined by one's genetics or their physiology, but by a complex web of direct and indirect factors that operate within systems that oftentimes neglect the poor and disadvantaged. There was a lot to take in, and in the moment, I just couldn't make sense of any of it. But what was even harder to navigate at that point in time was the complexity of emotions I felt afterwards. Like many of us who have witnessed poverty and suffering during our fieldwork experiences, in the days after meeting the woman, I was overcome with a wide range of feelings. I was sad, I was upset, I was jaded, and I even felt a bit guilty. But most surprisingly of all, I was overwhelmingly angry. Now, I'd like to think that I'm not an angry or spiteful person, but the woman's story frustrated me to no end. Why was her fate so different from mine? Why was she forced to face such hardship, and who was to blame? Why didn't it seem like anyone was doing anything to help? These questions kept me up at night, and the overwhelming emotions I felt when thinking about her story made me want to act. It was the sense of anger, outrage, and indignation that drove me forward and fed my urge to find solutions. Now, it's true that anger and outrage can blind us. It can distort our perspective and severely limit our understanding of larger systemic issues in global health. But on the other hand, I've come to realize that these feelings of anger often stem from our empathic consciousness, from our ability to relate to the stories of those whom we feel are being neglected or treated unfairly, from a place of goodness and humanity. Anger is one of the strongest emotions there is, and while we often think of anger as a negative, even destructive emotion, it has the power to inspire us to take action and bring about social change. In fact, Mahatma Gandhi once remarked, "I have learned through bitter experience that one supreme lesson to conserve my anger. And as heat conserved is transmitted into energy, even so our anger controlled can be transmitted into a power that can move the world." All of us in this room come from different backgrounds, and perhaps some of you can directly relate to the Indian woman's story in some way. But the mere fact that we are all sitting here today, graduating from one of the only global health undergraduate programs in the United States, demonstrates that we live on a bedrock of privilege that millions of people throughout the world are not fortunate enough to have. Global health is unique in that it is interdisciplinary, and we each approach the field through different lenses. But we are all unified by our conception of global health issues as issues of social justice. And when we witness injustice, we should be overwhelmed with feelings of anger and outrage, because in some ways they can be our most valuable assets in our search for solutions. As we graduate from Duke and move on to the next phase of our lives, I think that we should not shy away from being angry. In fact, as future policymakers, physicians, economists, global health professionals, what have you, committed to reducing health disparities across the globe, I think that at some point we will all find ourselves overwhelmed with anger and won't be sure of what to do about it, just as I was after that rainy day when I met that old woman in an Indian slum. My message to you all today is that I think that when we are confronted with anger, we should embrace it. We must feed off our feelings of outrage and channel it into something positive and constructive. We must use our indignation as a source of true motivation. Because as Gandhi noted, and as I've come to learn during my time at Duke, anger and hope do not have to be divorced from one another. With the spark, with the ability to recognize injustice and speak out when we witness something wrong, we can find the inspiration and energy needed to change the world for the better. Thank you.
To learn more about undergraduate global health education, visit globalhealth.duke.edu/undergrad.